Hi, my name is Chelsea Hudson, and I would just like to talk a little bit about my project, what I did my capstone project on, and that was over inpatient falls. This was something that was easy for me to pick because it's interesting to me, and also because I did my preceptorship with a nurse who works in quality improvement at my hospital and is always looking at evidence-based practice. So she got me really interested in looking at interventions, new interventions that can be implemented, and also she looks at patterns. So it was interesting to work this semester with her and learn a lot, and I also kind of wanted to look at some things on my own time. So some goals I had through this project were that through a literature review and looking at evidence-based practice, I could develop some interventions to improve in my own practice and improve fall rates. And I also wanted to improve outcomes for my patients and help my unit, my hospital unit, develop safer practices. So there's first question we can ask is, why do falls occur? And there's lots of reasons why they occur in the home setting, but I really wanted to look at in the hospital because that's something that we as nurses have more control over. So there's lots of education that needs to be involved in the hospitalized patient about their home and making their home safe and fall proof, I guess. But looking at the hospital, the falls that happen in the hospital, it's interesting because there's so many elements that can cause a fall. So there's medications, new medications that patients are put on, and there's new environment, and these are the two main things that was found to cause falls. So overall, falls are multifactorial, and there's lots of elements that can cause them. So the 5 studies I looked at, the first one dealt with looking at patterns for falls and studying patient surroundings. So one of the interesting things was that falls almost always occur at the bedside, the study found, and usually it's at the bedside while trying to ambulate to the bathroom. So I thought this was very interesting. So there's things that we can implement knowing this information as nurses to make sure our patients call out before they go to the bathroom. For our confused patients, we can use bed alarms. Also, this study showed that there needed to be more education for patients so that way they can be more compliant with their fall supervision to prevent them. The second study I looked at was one that was over call bell response times. So I think any nurse who's worked in a unit, you have those moments where it's chaotic and you've got, it seems like 50 call bells going off, and you've already got medication in your hand to give. There's just lots of things going on in the hospital. But this study looked at how making patients wait for their call bell, if improving that would indeed improve fall rates. And this study found that there was a slight decrease in fall rates with improving call bell response times. And I thought it was interesting because in this study it also found that improving response times to call bells is something that needs to be managed and improved by hospital managers. So unit managers need to look at this and give feedback to staff on how they're doing. The third study I looked at was implementation of a fall prevention program. So a fall prevention program, what it's talking about here is, I know we all do those fall risk assessment tools, as well as implementing interventions for every patient that scores to be at a fall risk using this tool, and then improving environmental safety, conditions in the hospital. So this study did a few different things. It did some actual construction in the hospital, and improved the, making sure that the floor was even. So sometimes, floors, they'll have that tile that patients have to step up on, or whatever, that can cause, some stumbling or tripping. So they improved that, and they also installed like more handrails in the hospital. So it found that that through implementation of a fall prevention program, patients can have better safety outcomes, and that we need to measure outcomes of staff compliance. So, it's kind of simple, really, if you think about it. Just, if we're not compliant with the interventions and the research that's already been in place to be the best evidence for our patients, then, it's no good. But this study also found that it was best for unit managers to regulate their own unit, because it's kind of hard for, to do on a nurse-by-nurse basis, or even a whole hospital to regulate these things. It needs to be per unit. The fourth study I looked at was nursing hourly rounds. So there's been a lot of research that's come out lately about hourly rounding. I know on my unit, we're supposed to do hourly rounding, and at nighttime it's every 2 hours, and you have to go in and check this little box saying that you rounded on your patient. So this study looked at hourly rounds to see if fall rates decreased when we were asking questions to our patients about pain, potty, and position. So these are things that patients frequently call out for, and it was found that rounding and asking our patients these hourly helped improve patient compliance with their fall status. So I think this is a great idea and a great plan, but I think the problem with all of these studies is that it puts so much more interventions on the nurse and the nursing staff. So there's lots of things that we need to do as nurses that aren't always possible with the amount of patients that we have. But I thought this study was interesting. And then the last study I looked at implemented multiple interventions. It's a multiple intervention strategy for reducing falls. So this kind of contradicts the other study that looked at having a fall risk assessment tool and implementing standardized interventions. This study looked at basing interventions by targeting patients' risk factors for falls. So instead of standardized implementation of falls, they looked at the patient's diagnosis and implemented a new set of fall interventions. So I thought these studies were really interesting because they were so applicable to clinical practice, and because they were all something that I think that we can easily improve in our practice. So some things that I think, well, at least one big thing I think that needs to be further researched after looking at all of these studies is that I think that someone needs to research and look into more about how increased nursing staff and more nurses on the unit decrease falls, because like I said earlier, all of these interventions are great and they're helpful, but it's impossible for, I know on my unit, to do these hourly roundings and answer all the call bells and, make sure our patient, is peeing every hour. It's trying to pass medications, and then you've got patients that are declining. There's so much going on in the hospital setting. There needs to be more nursing staff, is my opinion from working on the floor. So that's kind of the further research I was planning on looking into is, what does the what is adequate nursing staff to prevent falls, because according to the research, it shows that hospital falls really should be a never event, where they should never occur. They're not funded anymore when these happen. Adverse events happen in the hospital like falls. So to leave off, I guess, some key things I would like to leave with you all are some interventions that we can implement, and that's placing fall risk signs on our patient doors, putting fall risk bracelets on all of our patients who are at risk. Also placing mobility needs on patient boards. So I thought this was a really good one, because many times I'll have a patient who I'm unfamiliar with because they're not mine, and they'll call out, and I go in to answer the call bell, and I'm not sure really, how they need to get up and go to the bathroom. Well, I don't know if they're confused, or if they can get up fine by themselves, or, it needs to be listed in the patient's room on the whiteboard is what we do. Also, verbal communication of fall prevention status, and this is at clinical handover. So when you're doing your handover with night shift or day shift, we need to make sure that we verbalize, this patient, got up fine last night by themselves, or they really need two people to help them up to the bathroom. That's important. And then the biggest thing that we need to do is educate our patient on fall prevention, with not only the patient but also with the family, because families are usually a big part of patients' hospital stay, and this is something that they're going to go home with, like I talked about earlier. If they're fall risk in the hospital, chances are they're probably going to be a fall risk at home. So we need to make sure that we're educating our patients so they're not getting readmitted to our hospital for another complication related to fall. So I really enjoyed this project and getting to research fall interventions. It's something I was already interested in, and I hope I left you all with some good interventions you all can implement in your practice as well. So thank you.